Hello, and welcome again to the Clinics Review Articles podcast. I'm John Vasallo, Senior Clinics Editor at Elsevier, and I'm here with my colleague, Clinics Editor Megan Ashdown, and Dr. Joel Heidelbaugh, Clinical Professor of Family Medicine and Urology from the University of Michigan Medical School in Ann Arbor. Dr. Heidelbaugh is also the Consulting Editor of Elsevier's Primary Care Clinics and Office Practice and Editorial Advisor for our Clinics Collections. The Clinics Collections draws from Elsevier's robust Clinics Review Articles database to provide multidisciplinary teams with practical clinical advice and insights that can be implemented in individual specialties and everyday practice. The collections can be ordered from us.elsevierhealth.com. Today, we're discussing our latest edition of the Clinics Collections devoted to COVID. Although we are recording this podcast in late September 2022, and COVID is not as prevalent in the news, there are still tens of thousands of cases a day and tragically hundreds of deaths per day. And it is mind-boggling to say we've lost over 1 million Americans to COVID. With that in mind, and as we move into the fall season where the latest variants are likely to spread, it's obvious we still need to talk about COVID. So let us welcome back the editorial advisor for our Clinics Collections, Dr. Joel Heidelbaugh. Hi, Joel. How are you?
Doing well, John. Thanks again for having me.
Great. Well, as we move into the fall and winter, where do you see COVID going and its variants? Do you expect it to spread all over the U.S. or just be in certain areas?
Oh boy, I don't have a crystal ball, and if I did, I would want the whole thing to go away, of course. But I think we're always on the lookout for potential new variants. I think we're always going to be concerned that there's going to be a new variant and wondering how it's going to spread, where it's coming from, where it's going, and who it's going to affect. I would bet that there's going to be new variants in the fall and the winter. The question is whether or not they're going to coincide with influenza, or hopefully we'll have fewer influenza cases like we did last year.
Should all of us be masking up in indoor spaces still, public spaces?
Sure. That's the toughest question of all of them. I mean, the answer is we don't want to, but then the question is really, when should we? And, it's probably best in a lot of situations, in big gatherings, big spaces that we likely should. I don't know when we'll ever get the green light, the all clear that we don't have to do this. I think with appropriate precautions, and if you're in small gatherings and people are immunized, your risk goes down and your safety increases. I think if you're in a large space like an airport, where you've got people coming from all over the country, all over the world, and unknown immunization status, you're probably safer if you do wear a mask.
And what vaccine is available? Who should get it, and how effective is it for these new variants coming out?
Sure. So a new vaccine was released roughly a month ago, bivalent vaccine. It's supposed to incorporate many of the Omicron aspects of the variant. I always say to my colleagues, I need to learn the Greek alphabet to learn which variant we're on and which one's coming next. But everyone should get it. Everyone should get every offerable and available COVID vaccine. We need to keep our numbers down. We need to keep ourselves safe. And the reality is, if you get the vaccine and you still get a COVID infection, that you're going to get a much more mild form of the disease, and keep yourself safe and keep others safe, of course.
And you mentioned the flu earlier. So going back to that, is it okay to get both a COVID shot and a flu shot together, or should there be time in between? What are your thoughts on that?
Yeah, to my knowledge, I don't think there's any specific guideline, and I know we've kind of ping-ponged back and forth about the recommendations of this. Keep in mind, initially when the COVID vaccines came out, the recommendation was to separate the COVID vaccine administration from any other vaccine administration for at least a few weeks, really to enhance the development of immunity of COVID. To my knowledge now, there's no specific guideline. I think many practitioners will still recommend a bit of a separation, but the reality is we need to give immunizations, and people need to get them when they can.
Okay. So we'll dive into some of the articles in the issue. And let's get started with the article by Dr. Jill Mead on mental health effects of the COVID-19 pandemic on children and adolescents. So research shows that the duration of loneliness had the biggest impact on child mental health. Can you expand on how social isolation impacted children?
Sure. So when we were compiling this edition of Clinic's collections, I thought this was a really important one to include because children and adolescents especially have been one of those groups that's been very directly affected by the COVID pandemic. Certainly, while initially many of their numbers in infection were a lot lower, they were also directly impacted by their parents and relatives and people around them who were adults. Relative to the challenge of mental health, the impact of mental health and loneliness on children, it was a direct effect. It certainly was. And initially, remember, schools were affected and many schools shut down. Many schools went to online learning. Many schools went to online learning and then others opened up and there was still a disparity there. What this ultimately did in a lot of children was increase anxiety and increase panic, increase depression, increase isolation. Worse so in children that already had those conditions to begin with. It really heightened that and amplified that. A lot of children felt more isolated and resorted to more screen time in the household. And there was a huge adjustment for online learning and what the impact of that was on schooling. It certainly impacted schooling. It certainly impacted education. In my own practice, I heard this across a lot of families, whether it was school-age children, young preschool-age children, up to high school-age children, and everybody else in between. I think a lot of the most vulnerable were the younger children who really at that age needed the social interactions in the classroom, and that as a developmental learning skill was really kind of taken away from them.
So you mentioned screen time as another factor that contributed to the mental health of children. Are there any other factors that come to mind?
Sure. There was a lot of stress on parents and a lot of stress on relatives and guardians who take care of our school-age children. I heard from a lot of families that stress on the parents was augmented because now they were going to work from home. But they also had to watch their children. And in many cases, I heard they also had to teach their children as well, or supplement the teaching their children of what wasn't happening in an online classroom or certainly with the break in the live classrooms. And certainly that was a lot of stress on both the parents and the children. We also started to see a lot more disparities in terms of not only healthcare, but education. And this was really amplified across race and ethnicity. And it certainly impacted all of those factors and social determinants. I think one of the biggest challenges also at this time is the lack of resources to those who are marginalized, lack of resources to those who had greater adversity, and certainly lack of resources in being able to get appropriate mental health services in a lot of areas. I mean, I'm in an academic area, Ann Arbor, Michigan. We have a lot of physicians, but the demand far outweighed the supply of mental health providers, and not only psychiatrists and therapists and social workers, but all aspects.
And in your opinion, how did the pandemic affect children and adolescents that already had pre-existing mental health conditions? Was this a big thing for them?
Sure. I think in a lot of situations, I think it made it worse. I think a lot of that isolation heightened the anxiety, heightened the depression. There's a lot of data that shows increased suicidal ideation and suicide attempt in children. And I think it was harder all around.
And what does the ongoing research suggest about the long-term effect of the pandemic on children and adolescents? The issue published earlier this year, but what does the current research suggest?
Sure. Well, I think long-term, it's still, unfortunately, we're still sort of short-term, being only about 2.5 years into the pandemic. But going farther out, I think we have a lot to learn. I think we're going to see a lot of lasting effects on the impact of isolation on our children and adolescents. I think we're going to see a lot of lasting impact on anxiety and depression. And, it's also pushed us, and we're going to talk more about this later, but it's also pushed us into embracing telehealth, because while a lot of children and adolescents could not get adequate mental health resources for a variety of reasons, mental health resources really had to jump into telehealth quickly and allow for another modality of face-to-face treatment and support. And so I think long-term, we're going to see that is a modality that's here to stay. It's another way to deliver that kind of care to our children and adolescents. But I think the long-term research, it's still being done. I think we're gonna find that there's higher incidence of anxiety and higher incidence of depression, and a greater need for those services in longitudinal care.
You had mentioned health disparities a couple of minutes ago, and so that leads us into one of the articles in the issue, which is health disparities and their effects on children and their caregivers during the coronavirus disease 2019 pandemic, by Drs. Lynn Smitherman, William Golden, and Jennifer Walton. They point out that COVID-19 disproportionately affects children of color and children considered vulnerable due to their living situations or underlying health conditions. So to start, can you delve a little deeper into the health disparities the authors discuss in their article?
Sure. This was another really important article to include in this clinic's collection, because I think it's central to everything that COVID has touched. The authors were really bold. I like how at the beginning of their manuscript, they talked about a strategy to quote unquote dismantle social determinants of health. And, it's really what we're trying to do. Certainly COVID not only created more hurdles, but kind of raised the height on the hurdles of what we need to clear. A lot of what they talked about had to do with access to healthcare issues across the spectrum. And that spans, urban and suburban and rural communities. They also talked about challenges with immigration status. They talked about financial barriers. They talked about language barriers. They talked about a variety of social barriers that, oftentimes it's easy just to focus on money. I think it goes way beyond money. One thing that they touched on, and many of the articles, in this collection touched on, was the advent of telehealth served as a way to help reduce a lot of these social determinants and disparities, but in a lot of ways, it also accentuated a lot of them, because data shows that families with total income less than $50,000 a year had a lot of challenges even embracing virtual care due to connectivity issues or access issues there as well. So the authors did a really awesome job in terms of talking about the health disparities and highlighting a lot of the challenges that COVID brought on.
Mm-hmm. Yeah, so these health disparities are often caused by these limited access to care that you just mentioned, and some of the barriers. What can physicians do to help lower some of these barriers?
Sure. I think a lot of it really starts with and recognizing that this is not created equal across the board, but it starts with the resources that we have at our disposal. Okay. Not all practices are created equal, unfortunately, but there are practices that have dedicated resources across social workers, complex care managers, care navigators, patient account representatives to help folks who may have had a lapse in insurance or don't even have insurance, to be able to get that as a starting point for people. And I think that's a great outreach tool. In the past, it's been a lot about financial resources. It's been about transportation resources. I think the resources that we can have in our practices can really help people to reduce a lot of those barriers. I've heard and I've read about, and they even touched about in some of their work, the authors did, about ways to enhance assistance with patients and families with connectivity and access to virtual care, because we're way beyond now the limitation of patients coming to our office to get healthcare. The benefit now is if you can't get to us, we have other ways of getting to you and of connecting with you. Certainly the electronic health record has portal systems and message systems, depending on what system you have. But it still comes back down to access. And if our patients don't have access, they still can't reach us and they still can't get to us. So I think as physicians, I think we need to bolster our resources within our practices and our healthcare systems to be able to help patients with these modalities.
Mm-hmm. And some of these children and their caregivers throughout this pandemic have also suffered from concurrent physical health disorders, not just mental. Can you discuss some of the things that you've seen in your practice? What kind of physical disorders have you seen?
Sure. Well, I'm a family physician. My 24th year in practice, I continue to see and hear just about everything, ranging from injuries where maybe people aren't getting care or they're afraid to go to the ER, to a variety of cardiovascular conditions. I'm hearing more about people dying at home, where they can't get care, or maybe they're afraid to get care. I've heard a lot of patients don't want to go to the ER because they don't want to go to the ER and get COVID, or they don't want to come to the office and get COVID. This has impacted our obstetrical patients. This has impacted our newborn patients. This has impacted our patients with physical disabilities. It runs the gamut.
Okay. The article also mentions briefly about previous pandemics and how they affected health disparities in these communities. Are there any lessons we can take away and apply to this pandemic?
I think it still comes back to what we as healthcare providers and healthcare organizations can build as resources to help people out. There's a lot of systems now in place where we're delivering healthcare at home, whether it's physicians or nurses or advanced practice practitioners. Through telehealth, we can do a lot of monitoring of blood pressure and blood glucose, even fetal heart tones. A lot of technology has advanced because it's had to advance rapidly. We were going to do a lot of these things before the pandemic. The pandemic just made us do them quicker and hopefully safer and in a better way. And we're still learning from all of that. So I think as the pandemic hopefully shortens and ends, but unfortunately progresses to a degree and technology advances, that we're going to have more of these options available to us that will be resources for our patients.
We'll switch gears a little bit and dive into the article on the effect of COVID-19 on education by Drs. Jacob Hoofman and Elizabeth Seckert. I hope I'm pronouncing those names correctly. Virtual learning became the norm during the pandemic, as a lot of us know, and we've already talked about how that affected children and their mental health. But can you explain a little bit about how online education affected their learning?
Sure. Well, we've always made this assumption that you take 28 or 30 children, put them in a room, have one teacher, and that teacher's going to teach effectively for all of those children, and those children are all going to learn the same way. And, obviously there's a big fallacy in that because everyone learns at a different rate and in a different way. And then what we had to do is we had to say, okay, now you can't go into the classroom, so we're going to have an online class, and the teacher had to adapt quickly and had to transmit materials and had to prepare a curriculum that was going to keep up with that. And then you had to have students have accessibility and have the same ability to learn as if they were in the classroom. And unfortunately, those were really big stretches and big assumptions. I don't know the current statistics, but many children have attention deficit disorder or have difficulty grasping concepts the first time they hear them. I think putting things in an online platform was challenging for teachers and students alike. I teach in graduate medical education. It's been a challenge for me to do it. It's been a challenge for me to do online teaching. And these are adult learners. So we have a long way to go in understanding best ways of delivering education for both teachers and especially for learners in a much, much, much less interactive format.
So the article did mention adult learners as well. And it mentioned that during the pandemic, medical schools had to find new and innovative ways to continue teaching and exposing their students to the clinical settings. Can we talk about some of those innovations?
Sure. Well, there was a period of time in early to mid 2020 when the pandemic started, and then over the various phases where students were out of medical school, they were out of live patient care. or they were even out of hands-on classroom learning, and didactics all changed. So a lot of that was forced to go into an online platform, which again changed everything. It changed accessibility, it changed interactivity, it changed comprehension. There was a big gap where medical students didn't have the ability to do hands-on learning with patients, and they lost a few months. What it did do was it opened up our ability to practice virtual care. And then it opened up the ability for us to create curricula around how to teach virtual care. And certainly virtual care has been a necessity. Certainly it's been another way to provide healthcare for our patients. In many cases, it's excellent. In many cases, the patients embrace it and we embrace it. And in many cases, it also falls short of what we need to do for people because you can't do a physical exam or get adequate vital signs. So we've had to innovate around that. We've had to sort of learn, another modality of healthcare delivery. But at the same time, we've also been able to embrace that and teach students that there's other ways of delivering healthcare. And that might be in primary care, that might be in psychiatry, that might be in OBGYN, that might be in surgery. Obviously, we're not doing online surgery, but there's paradigms where you can do post-operative visits online through virtual care, and you don't necessarily have to have the patient drive an hour back to your office. You can do the incision online. And so we've embraced this and we've learned a lot from it. I think we have a long way to go and we're still learning. And of course, our learners will help direct us in where we need to go as well.
And how will this switch to online education affect learning in the future? Do you think it's here to stay?
It's absolutely here to stay. It will be some of both. I think going forward, there will be in-person learning. I think there will be online learning. I think there will be more self-directed learning. We just have to learn how to best adapt this and how to best teach it. And, there's no better way to do that than to learn from our learners and from the patients in this process as well.
Great. So let's talk about the fourth and final article we wanted to discuss in this podcast. And it's on the role of digital health during coronavirus disease 2019 pandemic and future perspectives by Dr. Laccaretti et al. And the article states that digital healthcare has been a revolution in this effort in effective management of patients with complex conditions. So we've all heard the term of telehealth, but digital healthcare is a newer term. So what makes up digital health?
Sure. These terms have their subtleties in what they mean. And I think there's many accepted definitions of many of these terms. My understanding, incorporating the term digital into healthcare or digital into telehealthcare, really embraces technology and devices to be able to monitor patients and to be able to get data from patients either in real time or in short proximity to real time that allows us to make decisions on therapeutics for patients and also some element of diagnosis.
Mm-hmm. The article mentions artificial intelligence and machine learning as well. So how does that fit into the overall sphere of digital health?
Well, I don't know when I'm going to retire, and I'm not going to disclose my age, but I hope I'm not going to be replaced by a machine anytime soon or by a computer. We've all seen those science fiction movies. But, I think in all seriousness, I think the element of incorporation of digital healthcare and technology is really great. If you go back at least 5 years before we were using the word pandemic and the word COVID, I remember hearing from various groups across the country, hey, we're developing this thing and we're going to have a great way to monitor patients' blood sugar levels when they can collect them on their glucometer, shoot them through their computer, shoot them to our doctor's offices. We can see them and then we can connect back with them through an online portal and tell them they're doing great or tell them to go up on their insulin or give some kind of management option for them. And I remember hearing that and I just thought it was the most foreign concept in the world. Like, how does that work? How are you going to do that? I also remember hearing, we've developed this device and we can monitor a patient's heart rate without them being in the office. and without them having to come in, and then we can tell them it's fine, or we can tell them, oh no, this is bad, you got to go to the ER, kind of a thing. I remember hearing all of that well before the pandemic. And so over time, there's been integration of digital health, artificial intelligence, whichever term you choose to use. And then now with the improvement of what devices can do, whether it's a smartwatch or a smartphone, we're only a few years away from everybody being able to monitor a lot of different health parameters of what we need to do and to send information to our clinics and our healthcare providers to be able to provide not only diagnosis but therapeutic monitoring. So again, I think the pandemic threw us into it a little bit faster, but out of that necessity comes the forward movement.
Yeah. So as a primary care physician, you use digital health in your own ways. But in what other ways do different members of the healthcare team use digital health, such as nurses or other practitioners?
Sure. I mean, again, I think everyone can collect data across a variety of different modalities. And certainly, our nursing teams, our home healthcare teams, our nurse practitioners, our physician assistants and physician associates are using these in a way that they can monitor vital signs. They can monitor heart rate. They can monitor weight. They can monitor blood glucose and a lot of really important parameters that at the root of it all, I think is going to be shown to be cost effective and will keep people out of urgent cares and out of ERs more effectively so that we can get information and provide safe therapeutic planning.
So combined with the telehealth, this digital healthcare will just be a real big benefit to seeing them in person.
It really will. I think we have accepted that we probably don't need to see every patient for every issue every day. Triage is exceptionally challenging. Filling that scheduling grid in clinics is a monstrous task that I don't want, and I thank the people who do it so well. But we've realized that there's other ways to deliver healthcare, and there's other ways to monitor patients outside of the office.
As the pandemic becomes endemic, how do you see vaccination or booster frequency evolving over the years? Do you think that it will need to be regular?
Ooh, endemic. I don't like that word, but I get it. From what I know, what I believe, and I wish I were going to be wrong, I think COVID is a permanent stamp in the dictionary of everyday language for all of us. I think there's going to be I'm going to say seasonal. I'm not going to commit to any type of time frequency here, but I think there's going to be boosters, and I think there's going to be updated vaccines and boosters based on the current variants.
And what have we learned from the pandemic so far that will better prepare us for future emerging diseases? What are the big lessons here?
Sure. Well, as a non-scientist and as a non-infectious disease physician or vaccine developer, we've learned a lot of technology about how to develop vaccines and how to develop them rapidly and how to distribute them rapidly. With this mRNA sequencing and development of vaccines, and this is about as much as I know about vaccines, they can take a current piece or snippet of the current virus and insert it into this vaccine sort of template, if you will, and then mass produce that vaccine. And I'm obviously making it sound a lot simpler than it is, but that's the basic premise. And I think that moving forward is going to allow us to make more effective vaccines and to mass distribute them very widely and very effectively. We still need more on provider education. We still need more on patient education. We have the technology. I'm a firm believer in these vaccines. I try to promote them for our patients. And I think we've learned that these vaccines are safe and effective and can reduce not only incidence, but severity of the disease. I think the other thing the pandemic has taught us is there's massive challenges with not only education, but healthcare delivery. But I think this is also where telehealth and online platforms have pushed us into the next stage.
This edition actually has 26 articles, and we only discussed 4 of them. Briefly, are there any other articles you'd like to mention?
Well, first of all, I'll give my thanks and kudos to all of the authors and author groups, because I thought that, especially at a time when everyone was stressed, everyone was overworked, everyone was uncertain about where medicine was going, and everybody was certainly feeling burned out, it's important to recognize that these folks took the time to put this material together and did a lot of research and did a lot of good writing to compile their manuscripts. So when we compiled this edition of Clinics Collections, we had actually the easy job in putting it together. They did all the work. But I think the excellent thing about this particular volume is it really spans all of the elements that we think of relative to COVID, from technology to vaccines to caring for a lot of different populations, to issues with disparities, and really kind of touching on many of the individual organ systems that we didn't have time to get into today. If I had to pick a couple, I was really impressed with the one on heart failure, because I thought that, similar to many of them, it really pushed things forward, and it's really going to continue to push us forward. We have a lot of patients that have heart failure. It's estimated 1 out of 9 death certificates say the word heart failure on the death certificates. So this is a huge issue medically and from a resource standpoint for us to manage our patients with heart failure. So if we can learn from the pandemic novel ways to take care of patients, stay connected with patients, deliver healthcare, keep in touch with them, manage medications, and try to keep them out of urgent cares, ERs, and the hospital during a time like this, I think it really says a lot going forward for how we can manage that subgroup of patients. The other one that jumped out at me is the one on women's health, because we had a really tough challenge that, it's easy to say we can't get a patient into the office. How are we going to take care of them? But I think the issues were really unique for pregnant women, certainly requiring higher acuity, certainly requiring higher needs, certainly enveloping all of the issues we've talked about, from healthcare resourcing and utilization to social determinants. I really was impressed with that particular paper because it talked about a lot of ethical questions about healthcare delivery. How do we guide limited resources? How do we build and maintain rapport with our patients at a difficult time during a pandemic, and when we can't see our patients and interact with them and physically examine them? It also touched on the challenges of how research on this population was really stunted during the period of the pandemic. And certainly it also touched on workforce issues, because we saw a lot of really challenging workforce issues, and we continue to see a lot of really challenging workforce issues, not only related to women's health, obviously relative to this particular manuscript, but in healthcare at large.
I think we're going to have a whole series of podcasts on work health issues, workforce issues, So we're about to wrap up this podcast, and I wanted to thank Joel and Megan for joining us. Joel, did you have any final thoughts before we say goodbye?
Again, I'll just thank all of the authors for their time and their dedication to their outstanding manuscripts, not only for the work they did, but at a time when everybody was really stretched and working above and beyond. And so I'm very thankful for that. I trust that this Clinics collection is going to be very well received. I know I learned a lot. I trust that everybody else will learn a lot. And I look forward to seeing, maybe 5 years down the road, the follow-up to the evolution of a lot of these issues and where we've had successes and where we need to still focus our efforts.
Well, thank you very much for all your insights. It's very much appreciated. And we will be talking to you for the next issue that we do in Clinics Collections.
Thank you very much.
Thank you for joining us for this edition of the Clinics Review Articles podcast on COVID with Dr. Joel Heidelbaugh. To purchase this clinic's collection on COVID or other recent editions on telehealth, addiction medicine, or depression, please visit us.elsevierhealth.com. For more information on the Clinics Review article program, which spans nearly 60 medical disciplines, visit www.theclinics.com. Be sure to follow us on Twitter at Clinics Reviews and subscribe to the Clinics Review Articles podcast on Apple Music, Google Play, Amazon Music, Spotify, or Stitcher. Thanks for listening.